This feature is brought to you by JPH-MP Direct, the companion site of the Journal of Public Health Management and Practice. Today, Michelle Haberstroh of JPH-MP Direct speaks with Dr. Robert Hahn, coordinating scientist at the Center for Disease Control and Prevention, about the effectiveness of year-round school calendars on improving educational attainment outcomes within the context of advancement of health equity.
I'm Michelle Haberstroh, and today I'll be interviewing Dr. Hahn from the CDC. My first question for you is, you recently published a systematic review in the Journal of Public Health Management and Practice titled Examining the Effectiveness of Year-Round School Calendars on Improving Educational Attainment Outcomes Within the Context of Advancement of Health Equity. What factors influenced your decision to conduct a systematic review?
Good morning, Michelle. We, at a project called the Guide to Community Preventer Services, do systematic reviews of public health interventions to figure out what works and what does not and what needs more evidence. We work in multiple domains, including automobile safety, tobacco control, excessive alcohol consumption, violence prevention. I and my team have been working on what we call health equity for the last 7 years. Health equity is achieving the equity in health and the causes of health for poor and minority populations. And so we started out by looking at educational interventions because they're a foundation of people's long-term health. And one of the issues we found with low-income populations is that during the summer, poor kids experience a loss of learning compared with better off kids. And what happens, presumably, is that these kids have less access to the resources that upper class and middle class kids have in terms of summer camps and reading programs and so on, access to libraries. And so these kids actually, while they benefit during the school year, they lose during the summer. So one effort that has been made to compensate for this gap is to think about year-round schooling, where you have, instead of a long summer break, you have shorter breaks spread throughout the year. And that's the reason we investigated year-round schooling.
Can you walk me through the steps that you and your co-authors took when developing your methods, specifically regarding your search process, and why did you choose to exclude studies that were not conducted in high-income economies?
Okay. We have the Community Guide has a systematic process for studying interventions. We begin with defining the intervention and the outcomes we're interested in. So in this case, what is year-round schooling and what are the outcomes we're looking at? We specify research questions that we want to answer. In this case, does year-round schooling improve health and educational outcomes for low-income children? We systematically search the published literature, including government reports, to find out what is available in terms of research. We evaluate each study. We have a set of criteria, such as good definitions of the intervention and appropriate analytic procedure and the proper sampling methods and so on, by which we evaluate each study. We then combine all the studies that we have to have a synthesis and an overall assessment of the evidence. We present these findings to our task force. This task force of experts from around the country meets 3 times a year, and we present to them our findings. They say, oh, we like this, we don't like that, please fix this, and come back to us. We do that, and then we write a report on our findings. If the findings are positive, we also have a group of economists who evaluate the economics of this. Is it cost beneficial or not? And then we publish our reports, and we have a dissemination team that helps us distribute our findings to a audience of public health practitioners and others who might find this useful. The reason we look at high-income nations is because the United States, which is the focus of our work, is unlike other nations in terms of educational systems. So the findings from other nations would not be useful, or many other nations, at least low-income nations, would not be useful for our particular interest.
After the search process was completed, 53 studies were included within your systematic review. How did you organize and review all of the literature gathered during your search?
Again, we have basic questions that we're looking at, and we found early on in looking at this literature that there were two forms of year-round schooling that had different purposes and different forms of organization, and so we looked at these separately to answer our question. One of these forms is called multi-track year-round schooling. In this situation, the goal is usually to save money on building new schools. So during the summer, the school is still full. Students take turns in occupying the school, and there are different tracks. So while, for example, 3 tracks are in school, 1 track is taking a vacation, and then when that track comes back, another track goes off and takes a vacation. This is a very complicated system because it involves separating the students. It involves teachers who may be constrained in the way they take vacations. It's a very complicated system administratively, and it's usually implemented in order to save building costs for new schools. So that instead of having a school unoccupied during the summer, the school is continuously occupied. The other form of year-round schooling is called single track, and in this case, all the kids take vacations at the same time, but there's no long summer break. The summer break is divided up and spread equally around the year. Some of these single track programs have what they call intersession, during which between the sessions where some of the kids are on vacation or break, the kids who need additional help or the kids who want advanced education can go to this intersession and get extra education. So we analyzed these two forms of year-round schooling separately because they have different formats and different goals, and we wanted to see whether each one was effective separately.
Could you briefly describe how year-round schooling correlates to health equity?
Yes, I'm going to answer that in 2 stages.
Okay.
First, education is a really powerful determinant of long-term health. Education has been looked at in several ways in public health. For example, we look at how a kid has to be healthy in order to learn well. If he's not hearing well or can't see well, that hampers, or is hungry, that hampers learning in school. Physical education at school is very important as well, and public health people look at that. And the third major way in which public health researchers look at education is health education, which is a major foundation of how people learn how to make healthy choices in their lives. We're looking at a different connection between education and long-term health. Education is a way of shaping the next generation. It provides basic problem-solving skills. It tells kids how to interact effectively. It helps them regulate their emotions. And so it creates people who can get around in the world if successful. And these characteristics allow an individual to act effectively in the world, to find a good job, to find a good place to live, to have a good income, to seek health resources and so on, as well as to know how to eat properly and be physically active, be safe in automobiles and so on. So that's the way in which we're looking at education as a way of promoting long-term health. With regard to year-round schooling, as I mentioned, we found that it's well known that low-income kids have learning loss during the summer because of lack of access to resources that better-off kids have. So the thought was that by having year-round schooling with shorter summer breaks or shorter breaks period, they would not have that loss. And so that's why we looked at year-round schooling as a way of promoting long-term health.
You and your colleagues conclude that there is insufficient evidence to determine the effects of year-round schooling on improved academic achievement. Could you briefly describe some of the inconsistency found in the literature and what measures do you suggest for future studies to bridge this gap?
With regard to multi-track year-round schooling systems, other than the administrative problems, the findings were inconsistent. So, and remember that the goal of multi-track systems was not primarily to correct for summer loss. It was to save school systems funding to build new schools and use the schools more fully during the school year. But the outcomes in terms of education were mixed. So there were some positive and some negative effects of multi-track school systems in terms of educational outcomes. In addition, some of the studies indicated that minority kids, low-income kids, were channeled into low-resource school tracks, which was highly prejudicial to their learning. For some reason not clear, the low-income kids were channeled into tracks in which the teachers were less prepared and experienced, and there were fewer classroom resources. This is obviously detrimental to these children. So that was a potential harm of multi-track systems. With regard to single-track systems, there appeared to be some benefit for low-income kids, minority kids. The challenge was that we could not tell whether these benefits were due to the intersession or to the year-round schooling itself. And none of the definitions we saw of year-round schooling, single-track year-round schooling, indicated whether intersession was an included part, a required part, or optional. In addition, if intersession is counted as part of year-round schooling, single-track year-round schooling, then the actual schooling is no longer the same amount of time spent in schooling as is thought to be fundamental to year-round schooling, which is you have the same amount of schooling, you just spread it out differently over the school year. So we could not draw a conclusion about single-track schooling because we were unclear as to whether the notion of intersession was included as part of the programs, whether it was intersession that was responsible for the additional benefit that we saw, and what the definitional criteria were. So we recommended that in future research, this issue be clarified, the status of intersession within these single-track year-round schooling programs.
It sounds like each school kind of can put the definition into their own terms. Mm-hmm. Okay, so what future research do you have to look forward to due to these results, and how can future research readdress summer academic loss?
Well, we don't, the Community Guide to Community Preventive Services, we don't do primary research. We summarize available research that others have already conducted. However, we do make recommendations for researchers to fill the gaps that we find in the research that is available. And as I indicated, we think that clearly defining whether single-track year-round schooling includes intersession or not, examining the time added in that addition, and then examining whether it's the intersession per se or the year-round schooling with the distributed breaks that makes the difference. This is important because this, if so, we can determine what it is that we can do to improve the learning for these low-income children. That's something we recommend for other researchers to do. We have actually stopped working on educational interventions and move on to housing as a determinant of long-term health, and we're looking at homelessness at the moment and a program to end homelessness for mostly low-income populations with severe disabilities.
Is there anything else that you'd like to add?
I think it's important to look upstream in public health. Public health researchers have commonly looked at what we call risk factors, immediate causes of diseases. And for many conditions, this is really important, infectious diseases and so on. But for health equity, the differential health of populations associated with, often associated with income and race and ethnicity, the roots of this inequity are often found in what we call social determinants, things like education, housing, transportation, employment. And so we are looking upstream to connect with agencies that are involved with these topics to look what can be done in terms of these upstream interventions to improve the health of poor and minority populations. We think that's an important frontier in public health, and that's the direction in which we are moving within this health equity project.
I look forward to hearing more about that later on.
Thank you.
Well, thank you.
This feature has been brought to you by JPH MP Direct, the companion site of the Journal of Public Health Management and Practice. To learn more about the research presented in this video, visit us online at journals.lww.com/JPHMP.